ॐ शङ्खं चक्रं जलौकां दधदमृतघटं चारुदोर्भिश्चतुर्भिः सूक्ष्मस्वच्छातिहृद्यां शुक परिविलसन्मौलिमम्भोजनेत्रम् कालाम्भोदोज्ज्वलाङ्गं कटितटविलसच्चारुपीताम्बराढ्यम् वन्दे धन्वन्तरिं तं निखिलगदवनप्रौढदावा.
Good evening. Respected dignitaries and of the dais, myself Dr. Krishnakumar Naick, and I am doing final year PG in Panchakarma in Ayurveda Vidyalaya, Hubli. And now I am going to present a secondary data what I have obtained from my esteemed institution, and this clinical study was done by Dr. Krishnakumar KM under the guidance of Dr. A.I. Sanakal. And the title was a clinical study on the management of primary hypothyroidism and Ayurvedic approach. Coming to the introduction, primary hypothyroidism is an endocrinal disorder occurring due to hypofunctioning of thyroid gland. In this condition, thyroid gland cannot produce sufficient amount of hormones pituitary gland calls for. The disease is characterized by unusual weight gain, decreased mental activities, slowing of physical activities, sensitivity to cold, menstrual irregularities, etc. Thyroid hormones have a major role in tissue metabolism, heat production, fat metabolism, and energy production. The detailed study reveals that it controls all the metabolic activities of the body, which according to Ayurveda are the functions attributed to Agni. Agni not only does the Ahara Pachana, Sarakita Vipajana, but also it maintains the process like metabolism, energy synthesis, etc. In short, we can say that whole human life depends on Agni. As we know, Shanti Agno Mriyate, even a person can die with improper or depleted Agni. In spite of many researches carried out by the endocrinology branch of modern science, there is no satisfactory treatment for the disease. Long-term use of hormone therapy is suggested in primary hypothyroidism. The disease primary hypothyroidism as such is not mentioned in Ayurveda, but the detailed study reveals that in this disease there is a dushti of kapha dosha and its asrayi dhatus, especially rasa and medo dhatu in the primary stage, and it can affect the other dhatus in the later stage with the mandata of both jadragnis and dhatwagnis, and thus it can be correlated with kaphaja nanatmaja vikaras. And as Acharya Charaka explains, vikaranam akushalo na jihmiyat kadachana nahi sarva vikaranam namato asti dhruvastitihi sa eva kupito dosha samutthana visheshataha. So, to correct this pathology, the line of treatment of kapha dosha is to be adopted, which includes treatment modalities like Pachana, Deepana, Dosha Avasechana, Shamana, etc. Hence, Trikatu Churna, which is having the Pachana and Deepana properties, Vamana Karma as a purification therapy, along with Vidangadi Loha Churna as Shamana Ushadi were selected for the purpose of Pachana, Dosha Avasechana and for the correction of Dhatwagnis respectively. With the above points in mind, here is an attempt to prove the efficacy of Shodhana followed by Shamana Ushadi, that is Vidangadi Loha Churna, in the management of primary hypothyroidism. In this study, we have taken 40 patients, and for the trial purpose under two groups, group A and B, each group containing 20 patients each. The patients under group A received Ayurvedic treatment, and patient under group B received tablet levothyroxine. Aims and objectives of this study were to study the hypothyroidism in detail in the light of Ayurveda, to assess the effect of Vamana along with Vidangadi Loha Churna as Shamana Ushadi in the management of primary hypothyroidism, and to assess the comparative efficacy of Ayurvedic treatment with tablet levothyroxine. Coming to the methodology, a clinical study on the management of primary hypothyroidism and Ayurvedic approach was carried out with the following materials and methods. The drugs selected for the clinical study were Trikatu Churna for Amapachana, Vachadhyakrita, that is prepared with Vacha, Shati, Haridra, Daru Haridra, Devadaru, Shunti, Haritaki, Ativisha, Musta and Indrayava. Then Madanaphaladi Yoga for Vamana and Vidangadi Loha Churna prepared of Vidanga, Nagara, Yavakshara, Lohapasma, Yava and Amalaki. as Shamanaushadhi, and group B received tablet levothyroxine. The follow-up was for 3 months. Coming to the inclusion and exclusion criteria. Inclusion criteria: adult patients presenting with the clinical features of primary hypothyroidism described in modern medical texts and fulfilling the Wayne's diagnostic index scoring system for suspected primary hypothyroidism. Second one, the patients with higher TSH value. Adult patients of either sex who are fit for the Vamana therapy. And the exclusion criteria were patients of secondary hypothyroidism, patients with cardiac abnormalities, patient with carpal tunnel syndrome, patient who were unfit for Vamana therapy, and drug-induced hypothyroidism, patients suffering from any infectious disorders and diabetes mellitus. The present study was a randomized clinical study. Coming to the interventions, sample size of group A was 20 and group B was 15 patients, because 5 patients have not completed this study, and Amapachana Tripadu Churna was given 3 to 5 days until the Nirama Lakshanas were observed in group A. Then Snehapana with Vachadya Krita till the Samik Slikha Lakshanas were observed. Abhyanga with Tilataila, Svedana with Svedana, that was Bashpa Sweda. Vamana was given with Madana Phaladi Yoga in Kanchanara Kashaya, as Kanchanara is having so much of very good actions in this thyroid disorders. Shamanaushadhi was Vidangadi Loga Churna, 5 gram BD along with honey as Anupana. Duration of Shamanaushadhi was for 3 months and follow-up was for 3 months. In group B, for 15 patients, we have given tablet levothyroxine 1.02 to 1.7 and for 3 months, and follow-up was also for 3 months. The assessment criteria were decreased mental activities, slowing of physical activities, sensitivity to cold, dryness of skin, coils and dry hair, constipation, tiredness, vague generalized pains, menstrual irregularities, forgetfulness, face swollen with puffy eyelids, decreased sweating, hoarse, husky voice, decreased appetite and excessive sleep. The result what we have observed was one patient in group A was has got markedly improved. Moderate improvement in group A was for 17 patients and in group B was for 13 patients. Mild improvement in group A was for 2 patients and in group B was 2 patients. Out of 15 patients studied in group A, 13 patients were moderately improved and 2 patients got mild improvement. Out of 20 patients in group B, 1 patient markedly improved and 70 patients were moderately improved. This table is showing the comparative efficacy of the therapy on signs and symptoms of primary hypothyroidism in group A and group B by using unpaired t-test. If we compare the result what we observed in both the groups, decreased mental activity, group A got 50% relief, group B got 58.35% relief. Slowing of physical activities, 53 in group A, 55 in group B. Sensitivity to cold, 55 in group A and 91 in group B. Dryness of skin, 45 in group A and 60% in group B. Coils and dry hair, 55 and 91. Constipation, 83 and 96. Tiredness, 63 and 70%. Vague generalized pains, 66.5 and 78.5. Menstrual irregularities, 83.35 and 95%. Forgetfulness, 54.16 and 53.35. Swollen face with puffy eyelids, 66.65 and 56.25. Generalized sweating, 50% and 53%. Hoarse husky voice, 25% and 57%. Then decreased appetite, 96 and 60%. Excess sleep, 55 and 56. Coming to the conclusion, the analysis of signs and symptoms of primary hypothyroidism reveals majorly the involvement of kapha dosha and its related dhatus, namely rasa and medus. The chikitsa is nothing but the breaking down of the samprapti of the disease. Hence, all the kaphahara measures which have the effect on rasa, meda and that can be adopted in primary hypothyroidism. The therapy under group A provided relief ranging from 52.38% to 79.63% with an average of 60.6%. The total effect of the therapy under group B provided a relief ranging from 42 to 78 on an average of 59.01%. The effect of group A showed statistically not significant result compared with the effect of the therapy in group B. The comparative efficacy of the therapy on the dosha dushti showed statistically not result with the control group. coming to the summary, primary hypothyroidism is most common thyroid disorder with a female-male ratio 6:1. Thyroid hormones have a major role in body metabolism. The hyperfunctioning of the thyroid gland leads to hypermetabolism and hypofunctioning lead to hypometabolism. The metabolism according to Ayurveda is nothing but the Ahara Parinama with Jatarakni and Dhatokni level. So the functions of the thyroid gland can be compared with functions of Agni as per Ayurvedic view. In an Ayurvedic view, Kaphahara Nidanas can be considered as Nidana for the disease primary hypothyroidism, because the Dushti of Kapha is the prime cause for Agni Dushti. The disease primary hypothyroidism can be diagnosed easily by serum analysis of T3, T4 and TSH. In most of the cases, the increased level of TSH and decreased level of T4 makes the diagnosis of primary hypothyroidism. The treatment as per the modern system is hormones therapy, which should be continued for a lifelong. According to Ayurveda, while planning the treatment, Kapha Dushti and Dushti of its Asrayi Dhadus along with Agni in both Jatarakni and Dhatokni level should be taken in consideration. The drugs which are having the properties of Kaphahara, Agni Dipaka, Srodoshodhaka, Medohara can be given in disease primary hypothyroidism. The Shodhana Purvaka Shamana Chikitsa is best for the better results. In this study, Shodhana Purvaka Shamana Chikitsa showed highly significant results in 14 signs and symptoms studied. The therapy under Group A provided relief of an average about 60%. In Group B, it was 59. Out of 15 patients studied in Group A, 13 patients were moderately improved and 2 patients got mild improvement. The effect of therapy in Group A showed statistically not significant result compared with the effect of therapy in Group B. Before conclusion, I want to just inform you that even though in Ayurveda almost all the diseases have been not mentioned, we can treat almost all the diseases according to its dosha dushti. So this presentation I want to conclude. Thank you very much.